Plantar fasciitis and heel pad syndrome are two common causes of heel pain. Now, there's a very simple test that we can do that helps differentiate between the two conditions, and that's important because both conditions require very different treatment approaches. So the plantar fascia is a broad, thick tendon that runs on the underside of the foot. So it runs from the calcaneus, which is your heel bone, on the underside of the foot, and it runs to the metatarsals, which are essentially the bones in your midfoot. Now, the function of the plantar fascia is to help give the foot support and stability. So what happens during walking or running, as we walk and the toes bent upwards, that plantar fascia gets tensioned, and that gives the foot more stability and allows you to walk or run effectively without the arch of your foot collapsing underneath you. So plantar fasciitis is when there is an irritation or degeneration of that plantar fascia on the underside of the foot. And although we use the term itis, fasciitis, that would indicate that it's an inflammatory condition, they've actually done research and they've found out that there is no inflammatory cells present in that painful tissue. So what it actually is degeneration of the collagen fibers that make up the plantar fascia. And whenever we walk or run and that plantar fascia gets loaded up, that's when it starts to hurt. And you feel that pain, usually localized on the underside of the heel. Now, fat pad syndrome is irritation of the fatty tissue that surrounds the calcaneus, and especially on the underside. And that can become inflamed with sudden increases in running or training load or jumping, or even a blunt trauma such as landing barefoot on a hard surface and causing irritation or inflammation of that fat pad under your calcaneus. So the test that we use to differentiate between the two is essentially a calf raise. Now, what happens when we do that, we load up that plantar fascia, just like I explained earlier. So if you have an increase in heel pain when going up onto your toes, that would indicate that your plantar fascia is likely the source of your heel pain. So if you have a decrease in heel pain when going up on your toes, that would then indicate that your heel pad is the source of your pain, and your diagnosis would be heel pad syndrome. The way that we manage these two conditions is completely different. So the management for plantar fasciitis, because it's a degenerative condition and there's degeneration and breakdown of those collagen fibers in the plantar fascia, we want to create an environment in the foot that's going to promote collagen synthesis and repair of that tissue. So we're going to use a range of treatments that essentially create inflammation, and that's going to kickstart the body's repair process and start repairing that plantar fascia. Now, heel pad syndrome, on the other hand, because it's a true inflammatory condition and there's actual inflammation of that fatty tissue, by creating more inflammation, that's going to make things worse. So the treatment for heel pad syndrome is a bit different. So plantar fasciitis, we want to promote an inflammatory response, whereas heel pad syndrome, we want to calm down, we want to settle that inflammatory response. So we can use taping techniques to compress or offload that heel. Also, wearing supportive footwear that has more cushioning and is softer underfoot can also just reduce the amount of irritation in that heel. So I hope this video has given you a little bit of insight into the two conditions and given you a way to differentiate between the two. If you're unsure of what the cause of your foot pain might be, reach out to your healthcare professional, because there's a few other causes that can also cause pain down to the heel that I haven't spoken about today. And your healthcare professional would be able to assess and diagnose it and get you set on the right path. Thanks so much for watching. I hope you found this video useful, and I'll see you in the next one.